Screen. And let's make sure. Okay. Can you see that? Awesome. Okay. So I'm going to go through what is being discussed around Medicaid, share some messaging in response to that, and also include some particular data relevant to the Latinx community and Medicaid. So you'll see that all as we go through, as well as sharing tools that we are developing to help um, make sure we're getting out the word that both our Medicaid program is extremely strong and it's under threat. And so that's what you'll see as we go through here. Just to level set for everyone, right now, Congress is proposing massive cuts to Medicaid to help pay for tax cuts. So this can actually be updated now. Congress has passed a budget resolution, which basically means these are the parameters they're going to think about as they put together the budget. And it calls on the committee that oversees Medicaid to cut $880 billion from their programs. Well, Medicaid and Medicare are the top things and the only places that those cuts could come from. And we know that this would have pretty devastating impact in North Carolina as well as across the country. We in our state have a trigger law. So that means if the federal government makes any changes to the share of the costs, and this is now for the expansion population, that ends expansion in our state. So we've now hit 650,000 people, which is amazing and has come through all of our collective work who could potentially lose their health care. And then there are other ways that cuts are being proposed that would not necessarily be expansion directed population, but because it would take billions out of the program, it would mean our state legislators would either need to make up that difference, which is highly unlikely, or they would have to cut who's being served or what services are being covered. So this is pretty catastrophic for the health and well-being of North Carolinians and again of folks across our country. So we all know the power of a shared message. We've done this together now through many public health efforts, starting way back in COVID times, but certainly in the expansion piece as well. It's part of how we got to 650,000 people enrolled through expansion in less than a year and a half. And so what we've done is really work on crafting what are our shared high-level messages. There are obviously things depending on who we are talking to that we might want to hone in on or might be resonate more. But what are those high-level talking points that can help us be strong and amplify and make sure we're really having our voices heard. So what did we learn sort of from our expansion effort that we're tapping into in these messages so they don't come out of nowhere? When we heard loud and clear that North Carolinians fully value Medicaid and they trust the department as a source of information and a conduit to services. So our research continually shows this. We also at Neimand Collaborative had the opportunity to more recently do some research about a range of issues. And one thing we did test was around cutting back on government-funded healthcare, and people overwhelmingly said that would raise the cost of healthcare and increase the number of uninsured people. That is true for North Carolinians as well. And so we want to really frame this one from a place of strength because our program is so strong, and also then being clear that it's under threat and reminding them that we need to protect the investments that we've made. So to do that, we have a high-level campaign theme that talks about Medicaid strengthens North Carolina, protect NC Medicaid. This speaks to, we should be naming the program in our state. Again, people recognize it and value it. It talks about why that it is a strong program and benefits, but also clearly conveys that it is under threat. And then I want to share that some of the messaging you'll see we were able to test because we had another research effort going underway in the state for public health. And so we did throw in a messaging statement to see what people thought. Was it believable? I'm not going to read it here because you'll see it in the coming slides, and the things that were less, we were able to parse it out, that were less resonant have already been removed, but you can see that um, that half the folks gave it a very high rating, and then another 40% gave it a good rating. So it resonated well, which is really strong. Okay, so here is our high-level primary narrative, and then we'll share how we break this down. So one, we want to convey that NC Medicaid is an innovative, fiscally responsible, and popular Medicaid program with bipartisan support that delivers for North Carolina taxpayers and helps keep North Carolinians healthy. Again, our messaging at this moment is primarily for policymakers, but it's what we also need to get out and let people know that there's a threat here. So it's a both end, but policymakers are top of mind. It provides affordable health coverage to 1 in 4 North Carolinians. That's access to doctors and prescriptions for more than 3 million children, older adults, people with disabilities, and working North Carolinians. So we want to also make this program real and establish that this is your constituents are impacted by this program and what it does. Despite widespread support for NC Medicaid, Congress is proposing massive cuts that will hurt North Carolina. Again, reminding them that there is widespread support for this program and that current proposals could take health coverage away from 650,000 hardworking North Carolinians newly enrolled through expansion, worsen health outcomes, take billions from our state's economy, disproportionately harm rural communities, and drive up costs for everyone, including employers. So we also want to be clear about what's at stake. Oops, sorry. As we then go through, let me just make sure we break that down, because again, there may be times you need to lift up or only focus on parts of what we are trying to get across. This first one speaks to it brings billions of dollars into the state's economy, $30 billion actually. And then 98% of Medicaid dollars in our state go to services and providers. So this is money that's going right back out into local communities, and that's a point we want to be emphasizing. Rural communities rely on Medicaid and will be hit the hardest. In some of our rural counties, more than half the population is covered by Medicaid. So again, these are our friends and neighbors, and by the way, policymakers, your constituents. This is our message that, again, speaks to workforce and expansion, that Medicaid supports North Carolina's businesses and workforce. Medicaid expansion provided affordable health coverage to veterans and workers in childcare, construction, hospitality, home health care, and other essential industries who could lose their health coverage overnight under changes being considered. When employees are uninsured, they miss more work, or less productive, and employers pay more. Well, we've only had the Medicaid expansion in our state for a year. It's been around for a lot longer, and so we can see and share that it does make people healthier. And so you can see here a list of things that we can point to in states that have had expansion for a longer period of time. I won't read through all of these for the sake of time, but we can share this deck as well, Viviana, so everyone can have it. This is a really powerful one and has, as it should, bipartisan support. Medicaid is saving lives and increasing access to behavioral health and substance use treatment. So overdoses in our state have decreased, and visits to emergency departments are down by 29%. And excuse me, and its suspected overdose deaths are down by 27%, from 2023 to 2024, and that was our first year of expansion. There are more behavioral health providers serving people covered by Medicaid since the launch as well. I won't go into these details again, but just reminding folks, here are the stats that North Carolinians value NC Medicaid. They do not want to see it cut. And one of the criticisms that folks are using, certainly folks in DOJ and whatnot,